Hello everyone, I am Nikka as Pilas from BSN12-E, and today we're going to proceed to the female urinary catheterization return demonstration. So urinary catheterization is the insertion of a flexible tube or the catheter through the urethra into the bladder to empty it of urine. So catheterization reduces the risk of infection and kidney damage by making sure that the bladder is empty either continuously or at regular intervals. So urinary catheterization is usually used when people are having difficulty urinating, natural relief, or this could also be used before or after a surgery when necessary. And also, catheterization is used to help in performing certain tests. So first, we have to check the doctor's order for catheterization. This is done to ensure that I have the right patient and the right procedure to be done. Okay. So next, I will perform a hand washing before preparing the set. This is to deter the spread of microorganisms that can cause disease and contamination. So after doing that, I have prepared the necessary equipment which save us time and energy, and this includes the two-way Foley catheter, the urinary bag, and our catheterization set. So after that, we have to introduce ourselves to the patient and identify the patient identity using the two identifiers to ensure that we are doing the right procedure to the right patient. So, good morning, ma'am. I'm Nikka as Pilas, your student nurse for today. So, may I see your wristband, ma'am? Please state your complete name and your birthday. Okay, so how would you like me to call you? Okay, so now we are going to explain the procedure to the patient so that the patient will be well aware of the whole procedure and also for them to cooperate well. Okay, ma'am, so um, we understand that you are having a difficulty urinating, so that your doctor, Dr. Grace, have ordered you to have a urinary catheter. So what I am going to do is to insert a tube through your urethra and connect it to your bladder so that you can excrete your urine. So later, what I am going to do is to expose your genital area, and you might feel a little uncomfortable later when we are doing the assessment, but afterwards, you will feel relief. So, will that be okay? So, do you have any questions or clarifications before we start the assessment? Okay, so before we start, I have to close the door so that no one from the outside will disturb us while doing the assessment. Okay? Okay, so now we have to position the patient in a dorsal recumbent with the knees flexed. So this is done to provide good visualization of the meatus where we will be introducing the catheter. Also, the gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. So ma'am, can you slightly flex your knees? Okay. So the next thing that I'm going to do is to secure the urinary bag on the patient's bed frame. So the urinary bag should be below the waist level of the patient's. So I'm going to put the urinary bag here. Okay. Now, I will drape the patient, exposing only the area to be used. So this is done to avoid the patient from getting embarrassed and having chills, which causes the tension and which may interfere with the easy insertion of the catheter. So, ma'am, I will expose your genital area. Okay, so I'm gonna put this. So I'm gonna leave here. Put this one. Okay, so I had already provided a direct line for visualization of the genital area, and also I have already opened the tray and arranged the equipment for the convenience and accordingly to avoid contamination of the sterile item. So next, what I am going to do is to use my sterile forceps to pick up some cotton balls soaked in a cleansing solution or a betadine to clean the genital area of the patient. So a thorough cleansing of the meatus and the area surrounding it reduces the possible introduction of microorganisms in the bladder. So first, I am going to line down and discard. So next, I am going to get another cotton ball and for the labia major and discard, and for the other side discard. So we have to remember that we should never retrace a stroke to ensure the that we do not contaminate the cleansed area. So now let's proceed to the labia minora and discard, and then another cotton ball and discard. So now we have to open the set and observe its sterile technique. So now I'm gonna open it. So inside my catheterization set is my sterile gloves, an eye sheet, sterile cotton with a cleansing solution. I have a pre-refilled syringe that contains 10 cc of sterile water, which I am going to use to inflate the balloon of the urinary catheter. I also have the sterile forceps for lubricant. So now I am going to add my catheter into my tray set. So I'm gonna open this one. And we have to discard this in a receptacle. So now I'm gonna use my sterile forceps and add this catheter to the catheterization set. And we're gonna discard this, and we have to perform a hand hygiene. And we're gonna wear our sterile gloves. Okay, so we're gonna fix this one. So it will properly fit our head. Okay, so we're gonna touch the sterile object and throw this one. So now we're gonna put the eye sheet. Okay. So now I am going to connect the catheter with a pre-filled syringe and lubricate the catheter for about 1.5 inches. So this is done to reduce the discomfort and friction, which in turn may reduce the pain upon insertion, infection, and dilation of the urethra. Okay, so now I'm gonna place my tray here, and I'm gonna pick up the urinary catheter for at least 3 inches from my from the tip of my thumb, with my one hand placed on the other or placed in the labia minora of the patient separately, and pull up gently. So now I'm going to insert the urinary catheter. So ma, can you please just relax? So now I'm gonna insert the urinary catheter for about 2 to 3 inches, or until the urine will flow out. Okay, so the female urethra is about 1.5 or 1.5 or 2.5 inches. So relaxation of the external sphincter aids in an easy insertion of the catheter. So we have to place the specimen, or if the specimen is to be collected, pinch the catheter because the urine will flow out if the lumen is not occluded. And we have to place a container in place. So we have to rest our hand in the pubis area while holding the catheter in place to prevent pulling or pushing the catheter. So now I'm going to connect the catheter with the urinary bag. So making sure that the urine bag is closed to avoid the leakage and maintain the sterility of the connection. Okay, so now we have to inflate the balloon, 10 to 15 cc of sterile water using 15 to 20 cc syringe. So the balloon will not prevent the catheter from slipping out of the patient body. Also, the catheter needs to be removed. Then the balloon will be deflated. Okay, so now we have to secure the catheter by taping it to the patient thigh and allow some slacks of the tubing to accumulate the patient's movement. Okay, after that, we have to remove this eye sheet. Okay, and then we have to place the patient comfortably. So I'm gonna remove this one. And I'm gonna turn off the light. So after that, we have to remove the sterile gloves and this card. So after doing this procedure, we have to perform the aftercare of the equipment used and perform hand washing and also document the procedure done. So the documentation of the urinary catheterization always includes the time of the procedure done, the amount and color of the initial output of the urine, the type and size of the catheter used. So I use a two-way Foley catheter, latex silicone coated. Its size is 14, and also record the amount of fluid used to inflate the balloon. So I use 10 cc of sterile water, the reaction and response of the patient, and include the other significant observation.